My name's Duncan McDonald. I'm a physical therapist. I've been practicing in the El Paso area now for 25 years. Initially, I was a high school teacher. I thought that's what I wanted to do. But after several years of doing that, I realized it wasn't what I wanted to do. Because of my background with exercise and physical activity, it was a logical progression from my first university degree to move into the physical therapy field. And it was the best decision I ever made. Here I am 25 years later and still enjoy what I do. At this point in time in the state of Texas, a physician's referral is required in order to complete physical therapy. Physical therapists can perform an evaluation without a prescription, but they can't initiate any treatment without a prescription at this point in time. The beautiful thing about orthopedics is it is a fairly simple field of medicine to work in because there are a series of logical steps to follow. If you have an ache or a pain or you've had an injury and you're waiting for it to recover, initially you tend to stop the activities that make you feel worse. You take some anti-inflammatory medication and see if it gets better. And if it does, fantastic. And if it doesn't, most people will typically then go and see a doctor. At that point, the doctor may prescribe a stronger medication and tell them to continue to rest and see if that improves. And if it doesn't, this is typically the point at which physical therapy intervention becomes important. We will start a series of treatment sessions. I tell my patients that if they don't feel better within 3 or 4 sessions, we're apparently not helping them very much. And if they're really in extreme pain, we send them back to the doctor pretty quickly to go to the next step, which is to have further investigative studies done in order to identify why they're having the amount of pain they have. They may require at that point MRI studies, for example. The MRI will probably determine what comes next. If they have findings that might respond to an epidural steroid injection, that would be the next process of intervention. If the injection helps but doesn't fix the problem, they may have a second injection, even a third injection. But after 3 epidurals, that's typically all of the epidurals you will get. And at that point, you have to decide if you can either live with the problem the way it is or take the next and last step, hopefully, which would be seeing a spine surgeon to have the problem corrected surgically. It is not very often that I see a person who is in great shape, who is not overweight, who does not get better quickly if they have a back problem. Okay, unfortunately, I typically see people who don't exercise, who don't look after themselves, who are overweight, and they tend not to do very well. Having said that, I think the single most important thing in terms of prevention of back problems is to routinely perform a very simple movement or exercise, and it's one of the McKenzie fundamental exercises. Routinely during the day, if you spend any prolonged period of time in a forward bent position or sitting, you balance the strain that you've been putting on your spine by bending backwards repeatedly. You do this 10 times every 1 or 2 hours. And this exercise will be of benefit by virtue of the fact that as human beings, everything we do involves forward bending. We lean forward, we eat, we reach, we clothe ourselves. We're always forward bending, and so there's always this pressure going on in the spine which puts pressure on the front of the disc and pushes everything backwards in the disc. And this is why 99.9% of disc problems happen in the back of the disc, not the front. And so therefore, the key thing is to counteract that stress and balance it out by routinely going backwards. But the problem is, we don't do that. And consequently, if we could start doing that as a routine exercise, I think most people would prevent problems from starting before they ever began. Whether it can be done standing or lying down preferably, I recommend to all of my patients when we finish rehabilitation, assuming that we've helped them, that they continue to do the McKenzie exercises in lying twice a day for the rest of their lives and standing on and off throughout the day. It is the single most effective method of prevention of future problems and is probably far more significant than getting in shape, getting strong and losing weight. Having said that, those things are still important. Sometimes I have patients, for example, who have come to me with cervical headaches. They've had a headache continuously for say 10 years. And literally within 2 minutes, with the right techniques, it has gone. I have patients who have literally been in tears with that effect because they have suffered unnecessarily for 10 years and were able to have all of their symptoms gone within 2 minutes with something so simple and then more importantly, something that they could do for themselves to maintain their headaches under control without needing medication or surgery or any other form of intervention. Those are the most satisfying cases. Patients who have these chronic symptoms that haven't changed and all of a sudden they change.